Hi there, you're welcome to Rx Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at Rx Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at Rx Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. Hi there. So what is our medication of choice today? Our medication of choice today is Rexulti. So Rexulti also has another name, which is a generic name, which is Brexpiprazole. And this medication is used for our patients who have depression or patients who have schizophrenia. So the medication is usually used as a 0.5 milligram to about 1 milligram tablet once a day, and the doctor can slowly increase this medication depending on how well the patient is tolerating it, as well as how well the medication is being effective in terms of treating the patient's condition. So for patients who are using this medication for depression, the maximum the patient will most likely be on with this medication is 3 milligram, while for patients who are using the medication for schizophrenia, the maximum is usually about 4 milligram. So in terms of side effect of this medication, patients may notice weight gain. Patient may also notice high blood sugar, as well as increased triglyceride, as well as patient may notice some headache, sleepiness while taking this medication. Some patients may notice diarrhea or constipation depending on how their body tolerates it. And some patients may notice some form of tremors while they're on this medication. So these are some common side effects that patients usually complain of when they are on this medication. So in terms of serious side effect of this medication, one of the serious side effect of this medication is akathisia. So akathisia is an inability for the patient to stay still while they're on this medication. So it's a form of condition where the patient is not able to keep still, and it just happened, involuntarily once in a while. Also, if you start noticing any form of seizures when you start this medication, make sure that you're reporting that to the doctor, as well as for patients who already have an underlying condition of diabetes. If you start noticing that the patient is, you're having more DKA episode, and DKA is what they know as diabetic ketoacidosis, like an increase in your ketone levels, make sure that you're reporting these to your doctor in order to make sure that they're monitoring the medication and making sure that the medication is appropriate for your treatment, as well as for other conditions that you may have. So what are other things to look out for while you're on this medication? So other things to look out for while you're on this medication is any worsening depression or any form of suicidal ideation or an unusual change in behavior while you're on this medication. You want to make sure that you are reporting those to your doctor. Also, while you're on this medication, you want to make sure that you're avoiding areas of high temperature, as well as staying hydrated in order to avoid any form of heat stroke due to your body not being able to regulate its body temperature well. And also, in terms of patients who are using this medication for a long period of time, make sure that if you have been sitting down for a long period of time, that you're getting up slowly in order to avoid a sudden drop in your blood pressure that may lead to a sudden fainting feeling, or you falling down from, getting up suddenly from being seated for a longer period of time. Also, if you start noticing any compulsive attitude, maybe you're gambling too much, you're being hypersexual, you're spending way too much or eating way too much after starting this medication, you want to make sure that you're reporting those behaviors to your doctor as well, in order to make sure that this is not as a result of the medication. Also, this medication may make you dizzy or drowsy. So if you are going to perform any activity that requires for you to be mentally alert, you want to make sure that you fully understand how well your body tolerates this medication before performing those activity right after taking the medication. That way it doesn't affect your mental activity as much, and also you're able to kind of tailor it to what time of the day that this medication is appropriate for you to take. Also, in terms of the dizziness and drowsiness, in our elderly patient, you want to make sure that you're watching out for any risk of falls or fractures in this patient due to that risk of dizziness or drowsiness. Also, like I said, this medication can affect your mental orientation. So if you are going to drive or do anything else that requires for you to be mentally alert, make sure that you're on the lookout and you fully understand how well your body reacts to this medication mentally before performing those activity. Also, if you've been sitting down for a longer period of time, making sure that you're rising up slowly. That way you don't get that sudden drop in blood pressure. All right, I hope I was able to let you in on some of the things to look out for while you're on this medication. If you haven't yet done so, make sure you give this video a thumbs up as well as subscribe to our channel for more information regarding other medication that we do present here for our subscribers here at Demi RX Care. And also you'll be able to help support our community here at Demi RX Care. Thank you so much for watching and stay tuned.